At the annual Delaware Rural Health Initiative Conference held June 3rd in Dover, Health and Social Services Secretary Kara Odom Walker talked about workforce issues and the need to make better use of skill sets in healthcare workers.
In order to do any of the work that we're talking about, the workforce has to be ready and has to be available. And I know, just walking around this morning, it was one of the issues that emerged, that we almost are at a place where we can't rely on physicians alone. I am a family physician, full disclosure. However, I also believe that medical training is not producing enough committed family docs to serve our communities. And so we're going to have to get to a place where we're more comfortable evolving and thinking about the expanded scope, where we have a team approach. That means community health workers, that means liaisons who could be from the community, promotoras and others who can really think about health education, outreach, and prevention in a new and different way.
Secretary Walker also talked with Brian Olson, president of the Delaware Rural Health Initiative and CEO of Lorette Health Centers, about the work being done by Lorette.
Well, as you know, we are very interested in moving towards a different payment model so that we can have our providers work at the top of their skill set. But competition for providers, whether they're primary care providers, dental providers, and sometimes other providers, behavioral health providers, is very difficult in southern Delaware in particular.
Yeah, I know you also get social determinants of health, and so part of the way we support providers is by having a suite of other services that are typically outside of the medical environment, but whether you're thinking about how to provide better access to SNAP and food services, or WIC, which you already do in a very robust way, or whether we're thinking about transportation.
Yeah, since the very beginning of Lorette, that was one of our cornerstones, if you will, transportation, because so many of our clients either didn't have driver's licenses or wouldn't drive because they were elderly and didn't trust themselves driving and so forth. So very early on, we had a transportation fleet in place to help our patients get to not only Lorette, but to all of our subspecialty referrals up and down the state. So that was a really important, as I said, cornerstone for us. It really helped us build our capacity and get patients into the center. But through the years, we've added WIC, as you noted. We have an on-site eligibility worker, and we have other social programs that help with housing. We have a robust homeless program in Sussex County, and we've learned that housing is a huge issue, not just for the homeless population, but just for the average worker in Sussex County.
Delaware Health and Social Services was also represented by Dr. Carol Rattay, Director of the Division of Public Health, and Elizabeth Romero, Director of the Division of Substance Abuse and Mental Health.
We spend our times, and do they support good health? So where you live, where you go to school, where you work, where you play, where you pray, is that supportive of good health? Do you even have a job? Can you find a job? Do you have the skills that you need to find a job? Housing, we're going to talk more about housing as consistently coming up as one of the most important determinants of health. Do you have stable housing? Is it safe housing? How vulnerable are you to being removed from your housing in the next 2 months? Important health factors.
Hopefully everyone in this room has heard the message. Addiction and behavioral health or mental health issues are chronic diseases. They are with people for their life, and it is okay. It is okay. There's no reason that there's a bad reason that they would have to go see their addiction specialist, just as I have to go to see my thyroid specialist, or someone has to go to their diabetes management. That is where we need to get to.